Addiction is a strong and dangerous need to regularly have something or do something.
There's a lot of factors, but I do know the younger that someone is, the higher risk they are at becoming dependent on it. I think there's around a 40% risk of that dependency, but the other thing you have to consider is how frequent that person drinks alcohol. I think that will have an impact on how dependent they are. Just to throw some numbers at you, as far as adolescents go, some studies that have been done, around 50% of all adolescents have admitted to drinking or tasting alcohol, and 20% have admitted to being drunk. So those numbers are probably actually much higher, just because people not wanting to admit to drinking alcohol for fear of getting in trouble. But so to answer your question, yes.
Underage drinkers have a 41% chance of having alcohol dependency compared to that of 10% for those who drink over the legal limit.
Some common risks of underage drinking: academic failure. Another thing that alcohol use can lead to is illicit drug use, criminal behavior, homicide, self-harm, suicide, and then of course the obvious health effects.
Underage drinking increases the chances of pancreatitis, hepatitis, liver cirrhosis, hypertension, and anemia.
Cortex, which deals with your senses, how there's a delay in that, and those can be off, as well as your central nervous system, just as far as your brain and your spinal cord working together. You tell your hand to move, it needs to move. So it explains why people have slurred speech, or why people can't walk straight. It's because their nervous system is affected. So that's just every time someone drinks. When you become dependent on alcohol and you're constantly doing that to your body, that's where you start looking at long-term, as far as function and structure of the brain, that's going to be affected. And the younger you are, since your brain's still developing and your body's still developing, putting alcohol in it and causing that shock toward it, that's going to be a little more detrimental for someone who's underage than someone who's an adult.
Annually, about 4,700 people under the age of 21 die from injuries involving alcohol. In 2013, 17% of drivers aged 16 to 20 involved in fatal motor vehicle crashes had a blood alcohol content of 0.08 or higher. In 2012, 71% of drivers aged 15 to 20 were killed in crashes because they were intoxicated and were not wearing seatbelts.